Hi, Dr. Ramsey Choucair. I'm a plastic surgeon in Dallas, Texas, who focuses on facelift surgery. And today, in part of our multiple video series, we're talking about the filler mania that seems to be going on with faces these days. I mean, you can't look at aging in this day and age without talking about not just surgery, but injectable fillers and Botox and things like that. So patients obviously come in saying, well, I really don't want a facelift. I just think I just need fillers. And of course, many times that may be true. But in general, a well-executed facelift, which again, if you've seen our other videos, is a facelift that improves your face from here to here. It really doesn't do anything, the term facelift, for your eyes. That would be eyelid surgery or a brow lift. So a facelift that improves you from here to here is going to elevate the loose tissue here, tighten the muscle in your neck, take fat out of your neck. Well, what about the folds here or the folds here or many other areas where patients lose volume, or the loss of volume in the eyebrow where the bone becomes exposed and doesn't look as youthful? Well, clearly those are areas where a facelift may not achieve the goal. So there's definitely a synergy or a complementary nature to fillers and facelifts. The key is knowing which to do and when. And that's the only reason that, plastic surgeons, in my opinion, still enjoy or want to do filler, because it's part of what we do. I still do filler in my practice. I still enjoy doing it. Many surgeons just don't enjoy doing it or think that someone else can do it as well, and that may be true. But in our practice, I do the fillers because it gives me an idea of the synergy that I need for the patient. For instance, patients come in and you know that when you do your lower face and neck lift that we're talking about, the cheek is still going to be somewhat hollow, or the area around the eye will be hollow, because the facelift does nothing for that. The facelift does nothing for lines around the mouth. That may be filler or another or a resurfacing option. A facelift can only do so much for a deep crease here. Even though you're lifting the jowl and making this better, many times there's still a volume loss that needs to be filled. That can be fat, it can be any of the off-the-shelf fillers like Restylane, Juvederm, Voluma. There's a whole host of those. I'm sure you've heard of many of them. Well, how to know what to navigate as far as these fillers and surgery is the reason that you really see a board-certified, experienced plastic surgeon, because even for us, we have to sit and think about what's best for each patient. It's not the same for each patient. So fillers are great. And where the fillers have really received a bad name is when they have been used to the exclusion of what would have been a better option, such as surgery. So for instance, many times a jowl will be prominent and in front of the jowl is an indentation. Filling that indentation will make the jawline look more even. There's nothing wrong with that to a certain degree, but if you're trying to avoid what is necessary, which is elevating the skin by just filling out the loose skin, then you start getting the distorted faces and the bizarre looks that we all see because fillers have been used beyond their scope. And that's why, a surgeon or a doctor who does this for a regular, period of time and looks at these things regularly can give you a better idea. So again, fillers are great, but they have their limit, and surgery is great, and it has its limit. Together, they can certainly make for a very nice rejuvenation. So I hope that helps you a little bit.